Have you ever felt a sudden, uncontrollable urge to rush to the washroom even when your bladder wasn't really full? Or maybe you wake up multiple times at night just to urinate, yet every test report says everything is normal? What if I tell you that the real cause of your urinary problem is not your bladder, not an infection, not even your kidneys, but your stress? Yes, stress. The silent enemy that quietly disturbs your hormones, your nerves, and your bladder function without showing any visible warning signs. Today, in this video, we are going to uncover a deeply ignored but extremely common issue faced by millions of women worldwide: how stress triggers urinary urgency and bladder problems, even in young and healthy females. This is not just another health video. This is a story. A story of how the mind, nerves, hormones, and bladder are deeply connected. And once you understand this connection, you will never look at urinary problems the same way again. I am Dr. Ayurmoolam, and in today's video, we are going to decode one of the most misunderstood conditions affecting women of all ages. Whether you are a student, a working professional, a mother, or approaching menopause, this information could change how you understand your body forever. Let us begin. Imagine this scenario. You are in a meeting, or stuck in traffic, or attending a family function. Suddenly, out of nowhere, you feel a strong urge to urinate. Not mild, not manageable. An urgent, uncomfortable pressure that makes you anxious. Your heart rate increases. You start searching for a washroom. Your mind panics. But when you finally go, only a small amount of urine comes out. This happens again and again and again. Most women immediately think, I must have a urine infection. But reports come back normal. No bacteria, no infection, no stones. So what is happening? This is where stress silently enters the picture. Our body has a beautiful communication system between the brain and the bladder. The bladder does not work independently. It takes constant instructions from the nervous system. When you are calm, relaxed, and emotionally stable, your bladder functions smoothly. But when you are under chronic stress, anxiety, emotional pressure, or mental overload, this communication gets disturbed. Stress activates the sympathetic nervous system, the fight or flight mode. In this state, your body thinks it is in danger. Blood flow is redirected, muscles tighten, and the bladder becomes hypersensitive. Even a small amount of urine sends exaggerated signals to the brain, creating a false urgency. This is why many women experience frequent urination during stressful periods, exams, job pressure, emotional trauma, relationship issues, or long-term anxiety. Now let us talk about the symptoms in detail. Women with stress-related urinary urgency often complain of a sudden urge to urinate that is difficult to control. They may go to the washroom 10 to 15 times a day. Nighttime urination increases, disturbing sleep. Some women feel a burning sensation, but urine tests remain normal. Others feel pelvic heaviness, bladder pressure, or discomfort that comes and goes unpredictably. Doctors often notice that these women do not have infections, stones, or structural problems. Ultrasounds appear normal, yet the symptoms persist. This creates frustration, fear, and sometimes even embarrassment. Many women stop traveling, avoid social gatherings, or constantly worry about toilet access. Over time, this creates anxiety, and anxiety further worsens the bladder symptoms, a vicious cycle. Now let's understand what is actually happening inside the body. From a medical perspective, the bladder is controlled by a complex network of nerves originating from the brain and spinal cord. Stress hormones like cortisol and adrenaline interfere with this network. These hormones increase muscle tension, including the pelvic floor muscles and bladder wall. When the bladder wall becomes overactive, it sends false signals of fullness even when it is not full. This condition is often referred to as overactive bladder or stress-induced bladder dysfunction. From an Ayurvedic point of view, stress disturbs Vata dosha, the energy responsible for movement, nerve impulses, and elimination. When vata becomes imbalanced, it affects the urinary channels, leading to frequent urination, dryness, anxiety, and restlessness. If stress continues, it also disturbs pitta, causing burning sensations and irritation. So you see, modern medicine and Ayurveda both point towards the same root cause: nervous system imbalance due to stress. Now let us talk about diagnosis. If a woman comes to a clinic with these symptoms, the first step is a detailed history. We look at lifestyle, sleep patterns, stress levels, caffeine intake, fluid habits, and emotional health. Basic urine tests are done to rule out infection. Sometimes ultrasound or uroflowmetry is advised to assess bladder function. In many cases, all reports come back normal, and that itself is a diagnosis. It tells us that the problem is functional, not structural. Knowing when to consult a doctor is very important. If urinary urgency is persistent for more than 2 weeks, affects daily life, disturbs sleep, or is associated with pain, blood in urine, or fever, medical consultation is necessary. Now, let us talk about the most important part: treatment and long-term management. The biggest mistake people make is only focusing on medicines. Medicines can help, but they are not the complete solution. Now let us talk about the most important part: treatment and long-term management. The biggest mistake people make is only focusing on medicines. Medicines can help, but they are not the complete solution. Treatment starts with understanding triggers. Caffeine, tea, coffee, energy drinks, spicy foods, artificial sweeteners, and carbonated beverages can irritate the bladder. Reducing or eliminating these can bring noticeable improvement. Stress management is the cornerstone of treatment. Simple practices like deep breathing, mindfulness, yoga, and regular physical activity help calm the nervous system. Even 15 minutes of slow breathing daily can significantly reduce urinary urgency. Pelvic floor relaxation exercises are extremely helpful. Contrary to popular belief, not all urinary problems need tightening exercises. In stress-related cases, muscles are already overactive and need relaxation. Sleep plays a huge role. Poor sleep increases cortisol levels, which directly worsens bladder sensitivity. Fixing sleep routines can dramatically improve symptoms. From an Ayurvedic perspective, herbs that balance vata and calm the nervous system may be recommended under proper medical guidance. Lifestyle correction, warm meals, oil massages, and regulated routines support long-term healing. In some cases, short-term medications may be prescribed to calm bladder activity or reduce anxiety. These are decided based on individual assessment and should never be self-medicated. The most important thing to understand is this: your symptoms are real. They are not just in your head. Stress creates real physical changes in the body, and with the right approach, these changes are completely reversible. Many women I have treated felt hopeless initially, but with correct guidance, patience, and lifestyle correction, they regained control over their bladder and their confidence. If you are watching this and silently suffering, please know that help is available. You are not alone. Your body is not broken. It is simply asking for balance. If you found this video informative, please like, share, and subscribe to the channel. It helps us reach more people who silently suffer without answers. Stay informed, stay aware, and take care of your health, because your body always speaks. You just need to learn how to listen.